Hey, it's Jessica DaMassa with WTF Health. I'm here at Health Datapalooza, and joining me right now, I have President and CEO of HIMSS, Hal Wolfe. Hal, it's great to have you here.
Thanks for having me. It's wonderful to be here.
Okay, so I want to jump right in and start talking about the global expansion of HIMSS. I feel like HIMSS has gone everywhere now. Tell me a little bit about the reason behind this branching out.
Well, HIMSS has been expanding. Over the last 10 years, of course, we've had an international presence and we're very large in the United States. But really, the demands of health are consistent everywhere.
Yeah.
And so when you're looking up at the challenges of health, when you're looking up at the silver tsunami, aging populations, increased burden on disease management, when you look at geographic displacement and delivery of care, and even the shrinking workforce or the workforce that's unable to keep up with healthcare, everyone's looking up and saying, HIMSS, can you step in? Can you help us develop our communities? Can you help us think about the frameworks that we need to have? Can you help us think through the next generation of policies around health and how we're going to do remuneration? And so we've been thrilled at that response, and we've been adding resources and expanding globally.
Tell me a little bit more, too, about what people are coming to you for advice on. I think that's so fascinating because, I'm lucky I get to travel around the world and go to these different health innovation conferences. And you're right, the challenges that everybody is facing are the same. It's like bringing down the cost of care, things like that. So what are they coming to you as HIMSS for advice on? You mentioned policy, but what else?
Well, I think if you take HIMSS as flagships, you look at our frameworks and you look at our maturity models. The most evident one, of course, is MRAM. When you think of MRAM, which is the electronic medical record maturity model, that is in over 6,500 hospitals, every single hospital in the United States, globally. And we take it from level 1, which is people that have paper and starting the digital journey, all the way up to stage 7, which means they are completely digital in the way that they approach. So when hospital systems and governments are looking up and they're saying, so what does our journey look like?
Yeah.
We actually have frameworks that help people move from point A to point B. And then that framework is one of many. We have analytics frameworks, we have infrastructure framework, which has grown tremendously this year, and then a continuity of care framework. How do I know how to take a patient and take them from primary care all the way through secondary care, into the hospital, back out, patient at home? These are journeys.
Yeah.
And so when you're thinking about your policy, when you're thinking about the development from a government standpoint, what is the outcome I'm trying to achieve? Our frameworks and our maturity models help people a lot. And then we sit down and they ask us, what happened in the country next door? What happened around the world? What are the experiences that you've seen that can help us from a policy standpoint? The same thing is taking place at the hospital level. People are looking up and asking, how do we innovate? And so we take our Health Box group as an example, which helps on innovation, consulting, investment components, and we give them advice and help them understand how innovation can be integrated into their overall program. So as you said, I think it was spot on, people are trying to solve the same problems globally, yeah. And we do have a tendency to look right where we're sitting, as opposed to be able to look globally and make sure it's applied from a rational standpoint. So that's what we're doing.
No, that's awesome. I love that. And I always say too, I'm like, I think every health system's biggest constraint is the payment model that they're in. And so it's helpful to remove that constraint by looking abroad and seeing what you can take back from a different, the way a different health system is tackling those same challenges. So it's awesome that you guys are leading in that way. I wanted to jump in on the innovation side of things, and you had mentioned HealthBox, which I'm a big fan of. And I think also in the digital health space, you guys are starting to expand more into that area. So tell me a little bit about the impetus toward moving in that direction from an innovation standpoint.
Well, you started off the comments about the reimbursement programs that most people have. And the cost of healthcare continues to rise, and it will continue to rise. And there's some real good reasons behind it, and some not so good. Some of the good reasons behind it is we've been investing in technology. It's producing a lot of data. That data is producing a lot of innovation. So then the question is, what innovation do I need in my specific system in order to deliver better use of information? And each system is different. So between Health 2.0, which takes a canvassing look of innovations that are around the globe, and HealthBox about the application of it, and then when you think about the back-end infrastructure to support it and all the other pieces that we do at HIMSS, these are the guidelines that we come back and look at. So the innovation part, getting to specifically to your question, is one of the driving forces. Healthcare is just learning how to do innovation.
Yeah.
And I say that because while there's always been innovation in healthcare, it has traditionally been relatively slow. It is very risk adverse. And true innovation, especially in the digital health space, is far more rapid.
Yeah.
And you have to learn how to fail fast. And that's new for healthcare. So failing fast simply means looking up and saying, hey, I'm trying this. It's not working the way I thought it would work. Let's stop. Let's go back and let's start over again. That's a different culture.
Right.
And so we're changing that culture. The other part of it, which is incredibly important in innovation, is that it ties itself back to the change of an organization and how it functions.
Absolutely.
So we use this really cool formula, which is NT plus OO equals COO.
Okay, you're gonna have to break all that down.
And it simply means new technology plus old organization equals costly old organization.
Good.
So you just can't grab innovation,
No.
throw it into a system and think it's going to make a difference. And that means anything from putting in an EMR all the way to a small application that's going to monitor someone's heartbeat.
Right.
You've got to redesign your organization around it, or we are simply going to run out of money, and we have to redesign the way care is delivered.
Yeah, I think you're spot on that. I'm wondering too, from your perspective, what kinds of challenges are you seeing health systems struggle with when it comes to innovation? I mean, I think taking this like cultural approach and looking at the whole system
Yeah.
as opposed to like doing something minute. But I mean, you guys, it's so funny. I feel like HIMSS is such a blend of now it's got the startups in the digital health space, but also the traditional healthcare establishment.
Yeah.
So I mean, and that's usually where it's like the rubber meets the road with innovation is at the establishment's doorstep. So I mean, tell me what advice you give to those big healthcare companies when they're talking about innovation and bringing innovations in.
Yeah. Well, first of all, it is that incredible vortex. It's that moment of truth where they're hitting each other and starting to swirl. The concept of changing the culture inside the healthcare system is important, but innovation has to be carved out. I mean, the number one lesson learned
What do you
is...
mean by carved out?
Yeah, so that's the number one lesson learned. Here's the issue. Every day there isn't a single hospital, healthcare system, or government that doesn't have a list of of things they need to fix in the current system just the way it is.
Right.
Everyone's occupied. Now you're going to come in and say, here comes change. It's going to disrupt that one-to-N list that you currently have. So where are the resources going to come from? Where is the money going to come from? How does it fit into the strategic plan? So you literally have to make a decision as a system, as a government, I'm going to carve out a certain amount of resources, a certain amount of targeted energy, which is devoted to integrating innovation into the system. Then you have to go through the process of saying, which innovation? How am I going to grab a hold of that? How am I going to make the decision about the innovation that makes the most impact? And of course, if you've seen one hospital or one healthcare system, you've seen one hospital and one healthcare system.
All unique.
All unique. And you could make an argument floor by floor. So you really have to have a handle, on what you're doing and why. And that's where we can help. And then, of course, there are many great organizations out there that really specialize in this as well. But you have to get that plan and that strategy together and understand, and that's what healthcare systems are getting around.
Yeah, your enterprise view of this is just really interesting to me. I also want to get, last thing from you, I want to get some input from your view at the tippity top of HIMSS. What do you see as some of the trends that are coming down the pike that are going to shape the way that we are innovating, or some of the innovations that are going to shape the way? I mean, everybody's excited about the big consumer tech companies coming in. Are you? Give me, tell me a little bit. Give me some gossip here about what you're excited about moving forward, what trends you're seeing.
Well, I think the fact we're here at Datapalooza, which is important, is that the use of data and really the use of information is changing in healthcare dramatically. And it's changing because we have a critical mass. We also have a massive amount of data being produced in the globe and getting our arms around that. So when I started really looking at this 5 years ago, we were doubling the amount of data in the world about every 18 months. It's now down to literally 72 weeks. So you're getting doubling of the data that's happening. And it's an astounding amount, right?
That's crazy.
I mean, so it went from 24 months to 72. So now it's just an astounding amount of information that is doubling. And these are IBM figures that are coming out. 72 days, I'm sorry.
Yeah.
Let me go back and make sure we correct
no,
that. So literally going from every 18 months to every 72 days, so we're talking 2.5 months, we're doubling the amount of data in the world, right? So when you think about that onslaught, how do you grab a hold of it? What do you do? So I think one of the most important elements is we're going to see the development of AI, number one, to help with clinical decision support, because it's a game about knowledge management. It's a game about collecting all this information and deriving value from it.
How close are we on that, you think?
Well, I think we're already beginning to see
Okay.
it. I think we're beginning to see the use of AI in applications. We're beginning to see large-scale clinical decision support capabilities, beginning to use artificial intelligence. And there's some trickiness here, and let's talk about that. There has to be, first of all, security. There has to be a clear understanding of what data is going to be used, by whom, with the right safeguards. And then secondly, we have to understand what's in the black box. AI can be very tricky. It can actually build on itself, which it does very quickly, but if you don't understand why it's building on itself or how, it can take you to a logical conclusion, but it may not be the right conclusion for the situation you're in. So that's where the data scientists are so important. We're beginning to see that. We will see the expansion of blockchain. We'll see the expansion of the use of information in ways we haven't, but the neatest part will be the consumerization of healthcare.
Okay.
This is really going to be the flip from inside out to outside in.
Okay.
How is the individual developing the use of their data and information? How are they engaging on the phone? How are they engaging on whatever device they're using? It's the phone temporarily, because it's the latest presentation layer, you know. But you don't build around the phone, you build around what am I trying to accomplish, right? It's just a piece. But that's what's really happening, and it's happening at a pretty fast pace. And so I think when you look up and you
Fast for fast or fast for healthcare?
super fast for healthcare.
Okay.
And reasonably fast for technology.
Okay, no, fair enough.
So you mentioned earlier the outside folks coming in, so to speak. But really all we're doing is expanding the ecosystem. We're starting to expand the ecosystem of healthcare because we've reached a critical point within the health ecosystem to be able to allow players who have incredible expertise in predictive modeling and AI and benefit administration and innovation. So when you're looking at the Amazon, the Googles, the Berkshire Hathaways, all of those folks finally realize that there's enough technology platform, there's enough information platform to really start to make change. So I see the disruption that's coming as fantastic. I think it'll do nothing but elevate our care delivery models all around the world and really take us on a path which is going to demand even more and better information and data across the globe, and that's one of our objectives.
That's it. All right, Hal, we're excited about this future, right? I can't wait to get there, really. It's so good to talk to you. Thank you
Same
so
here.
much for stopping by. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.